Up to this point, we've covered several topics of licensee misconduct, all that have a negative impact on patients and their safety. But there's another topic that we've yet to discuss that's a fairly prevalent issue and often causes direct harm to the patient population and to the provider. That topic is impairment. If you're like me, the first thing that may come to mind is severe substance abuse issues. A surgeon coming into the operation room still hungover from a night before, or a practitioner stealing vials from a medication cart. Sometimes these are the situations we're talking about, but there's so much more to this topic than broken bottles and rehab stints. Let's talk about it. You're listening to MedBoard Pulse, a podcast by the State Medical Board of Ohio. I'm your host, Jerica Stewart, Chief of Communications. Let's talk, Ohio. Hello, listeners. Welcome back. Hopefully you were able to enjoy the holidays and get some rest, spend time with loved ones, and use moderation, which leads us into today's episode. By now, you should know the medical board's objective is protecting the public through rules, policies, and disciplinary action if necessary. The difficulty in handling cases involving impairment is that they are not usually one-dimensional. But I'm getting ahead of myself. It would be helpful to first define impairment. According to Ohio Administrative Code 4731-16-01, impairment includes the inability to practice according to acceptable and prevailing standards of care by reason of mental illness, mental disorder, or physical illness, including but not limited to physical deterioration that adversely affects cognitive, motor, or perceptive skills. Impairment includes the inability to practice in accordance with such standards without appropriate treatment, monitoring, or supervision. Which means a provider with impairment can come in many different forms. For instance, practitioners recovering from a surgery that became dependent on pain medications, or a practitioner that suffers from a debilitating stroke and now has limited dexterity, or maybe even a physician that is struggling with untreated bipolar affective disorder, which can make it hard to carry out day-to-day tasks. It paints a different picture than what you would have expected. Interestingly enough, sometimes mental or physical issues can be compounded with substance abuse and addiction as well. Impairment can affect any type of board licensee, physicians, massage therapists, dietitian, or anyone else that we regulate. Regardless of the form of impairment a licensee is experiencing, the very definition of impairment is that the practitioner is unable to perform their job at the proper standard. And so it's the board's responsibility to remove unsafe practitioners from practice. Later in the show, you'll hear from our Chief of Quality Intervention about how the board has worked to create non-disciplinary pathways back to health. But first, I want you to understand how an issue like this is brought to our attention. For today's episode, I asked one of our East investigators, Jason Almeida, to hop on a Teams call with me and talk about his role at the medical board. So, Jason, can you please introduce yourself and explain your role at the medical board?
Good morning, Jerica. Thanks so much for having me on the podcast today.
Absolutely. Thanks for coming.
My name is Jason Alameda, and I'm an investigator here at the State Medical Board of Ohio. I've been an investigator at the board for the past 8 years now, and prior to that, I was a police officer in the Cleveland metro area. My role as an investigator is to obviously investigate complaints that have been forwarded to the State Medical Board. Some of the complaints that we receive involve allegations of improper prescribing, unprofessional conduct, sexual misconduct, and allegations of provider impairment. As an investigator, my goal is to conduct a very thorough investigation into all these complaints and determine whether or not these allegations are substantiated.
That makes sense. I think most likely we've all seen some detective shows before, and we have an idea of what happens in an investigation. I have several shows that come to mind, but that depiction in a TV show is not exactly what we're doing here at the board, as I understand it. Can you walk us through what happens when a complaint is triaged and then actually given to an investigator?
Certainly. An inside look into our investigations would reveal that yes, things are much different than how they're portrayed in movies and television. As much as I would like it to, our job does not involve all-night surveillance or high-speed car chases, but instead it involves an accurate and thorough gathering and review of all the evidence and facts that we uncover during an investigation. When a complaint is triaged, that's to say assigned to an investigator, the first thing that I do is conduct a thorough review of the complaint itself. I will then identify relevant people that might need to be interviewed and conduct those interviews as appropriate. I obtain documents, sometimes human resources records, patient records that would be pertinent to the case, and review those as well. And there are some times when we also need to do a deep dive into a provider's social media account, and we also may need to contact other agencies for assistance as needed. Again, there's some occasions where additional agencies like law enforcement or other state boards or departments will need to be involved. And in cases like that, we would work collaboratively with those agencies.
Is it true? Do you
One,
guys also work with any federal agencies?
yes, I've had interactions with FBI, DEA, Homeland Security in some
Oh, wow.
cases. So yeah, we do a lot of collaborative work with agencies at both the federal, state, and local levels.
Oh, wow.
Once I complete the investigation of a complaint, if additional disciplinary action is warranted, then obviously the matter would leave investigations and would be forwarded to our enforcement division.
Okay. And so that's really what your job is then, is to get all the information so that if we need to move forward with a case, enforcement has the necessary evidence to be able to write up a site or, form a case against that person.
That's correct.
Okay. So today we're specifically talking about impairment. And, a little bit earlier in this episode, I defined impairment as it's defined within this statute and the rules, the medical board. So as an investigator, what type of behaviors are you looking for when allegations of impairment are presented to you?
Again, as we just talked about, there are several types of impairment: that mental illness, the physical illness, and substance abuse related impairment. A practitioner could display different types of behavior or actions depending on what specifically is happening with them. Obviously, someone with physical injury or illness would have different signs than someone with a substance abuse disorder. When I receive an impairment complaint as an investigator, many of these complaints originate from a patient who had recently seen the physician, or sometimes even a concerned coworker.
Hmm.
Uh, I'll speak with these individuals as well as other facility or hospital staff members, and I take the observations of these individuals into account, as well as then my personal observations of the provider. And some of the behaviors that I look out for when I have those personal interactions, those include coordination issues like difficulty maintaining balance or poor motor control.
Okay, that
S-
seems pretty clear.
mhm. Slurred speech, bloodshot or glassy eyes, uh, cognitive changes like decreased attention and focus, uh, impaired judgment like risky behaviors or showing a lack of awareness for consequences, sometimes memory issues, difficulty recalling recent events or following conversations, confusion or disorientation, emotional or behavioral shifts like mood swings, excessive paranoia, or excessive anxiety, sometimes even overconfidence. Almost, it presents almost as a false sense of invulnerability.
Hmm.
Uh, when I do my interviews with physicians, obviously I'm always aware of inconsistent responses to questions posed to them in the interview and inconsistent speech or thought patterns.
Hmm. Interesting. It seems like a wide variety of kind of some hints or clues that you're using to be able to indicate if there's an issue or not. How do you determine who to speak to when you're conducting an investigation?
Well, that will largely depend on the type of practitioner, but I like to speak with anyone who has close contact with that physician, whether it's a medical assistant, medical scribe, LPN or RN that they work with frequently. Sometimes, if it's a physician assistant, I'll have a dialogue with their supervising physician.
Mm,
Maybe even times I'll have a conversation with a hospital's HR department or one of the risk managers, just to make sure that this is not a problem that has taken place beforehand.
I see. That makes sense because really you would be talking to people who would get to see them at all points in the day and not just in front of patients, but behind the scenes in the break room or, while they're getting ready. I think that's also important to mention. We've talked about a duty to report before, and seems like a place where that would really become relevant, that licensees of the medical board are actually obligated to report to the medical board if they're aware of someone who's in violation of board rule or law. So if another medical board licensee is seeing something, it's really their responsibility to speak up, to file a complaint, and to let us know if there's an issue.
No,
Um,
absolutely, that's correct. And just to cite as an example, I recall one specific case where, I had several registered nurses that had contacted me, and it seemed like a fairly benign complaint on the surface, but it did lead to an impairment issue involving the physician. But their concerns were that both of these nurses had seen this individual frequently falling asleep at work at his desk, and
oh
they felt that
no.
that was something that was, yeah, concerning to them, that it would be 11 o'clock in the morning, and obviously we have a provider that's in his office sleeping for 30 to 45 minutes at a time.
Hmm. That does seem a little alarming. I'm glad they were able to report that kind of issue. Another question for you. Do licensees always know when they're being investigated? That seems like something that would make someone jumpy or on edge.
Mhm. Well, when I get assigned a complaint, I always contact the licensee and advise them that a matter had been referred to the investigative unit. However, um, I may complete several investigative steps, like conducting some interviews or obtaining documentation prior to contacting the individual. In fairness to the licensee, I always provide them with an adequate opportunity to speak with me and address any concerns that they have regarding my investigation.
Again, thinking about all of our lovely favorite shows, Inspector Gadget and Sherlock
Mhm.
Holmes and all these things, right? What is the ultimate goal of an investigation? Because it seems like it would be to catch the bad guy, but what really is the goal for us?
Well, the ultimate goal of an investigation for myself as an investigator, it's to uncover the truth and to ensure that all relevant facts are accurately gathered and understood. Again, my goal as an investigator is to conduct a fair, unbiased investigation and provide the medical board with a factual and evidence-based conclusion so that they can make the necessary decisions as far as what steps to take next.
I really appreciate you pointing that out because it is not the board's goal just to, again, like I said, catch the bad guy, right? We're not just trying to be punitive. We're not trying to trap people, or trick them into doing something. We really want to find out what's going on. So if there's a complaint that we receive, it's our responsibility to flush it out, make sure that there's not a concern there or something that's not putting patients at risk. So thank you for clarifying. We really want the truth. The truth is the most important part. And so if that means that this licensee is not violating Ohio rule law, or if they're not, a risk to patient population, then it's okay for us to be able to move on, close that complaint, and not take further action. That's really kind of a success, honestly, if the
Mm-hmm.
person is doing what they're supposed to be doing.
Absolutely.
Well, here is, of course, the best question of the day. What is your favorite part of your job at the medical board? And you've said you've been here about 8 years. They're kind of like dog years here.
Mm-hmm. Well, each investigation comes with a new set of circumstances and challenges. And I like that. Every day is different and unique. I like the intellectual challenge of solving puzzles, solving cases, and interacting with different people. So that's definitely some of my favorite parts of the investigative side of this. But for me, it's also knowing that my work is contributing to making citizens in Ohio safer and ultimately protecting the public.
Yeah, absolutely. I'm so grateful to Jason for explaining the investigations process at the board. And now it's time for a Medical Minute segment with Dr. O'Neill. Let's find out what we're talking about today. Hi, Dr. O'Neill. Did you enjoy your holiday season?
Yes, I had a great holiday, but now it's over. We're back into that grind of work, trying to keep those New Year's resolutions. And, if you're here in the Midwest, what do we have every day? Gray skies. So I think this month we need to talk a little bit about our mental health. Did you know mental health conditions are far more common than you think, mainly because people really don't want to talk about it. They're really scared to go forth and get help. Some statistics in the United States that 1 in 5 U.S. adults experience mental illness each year, and 1 in 6 children, school-age children, experience mental health disorder each year. And mental health disorders occur at an early age. 50% of all lifetime mental illness begins by the age of 14, and 75% by the age of 24. And, a mental health condition is not the result of just one event. There's research out there that suggests multiple linking causes: genetics, environment, lifestyle, stressful job, and home life makes some people more susceptible to these traumatic, events, and more susceptible to a mental health condition. Each illness has its own symptoms. Common signs of mental health illness in adults and adolescents can include some of the following: excessive worrying or fear, feeling excessively sad or low, change in eating habits, change in sleeping habits, change in your sex drive, lack of insight. The worst thing that's out there is the thoughts of suicide. And, that's something that we definitely want to address and know those warning signs, especially if any thoughts of suicide are occurring.
What resources are available to help cope with these kinds of issues then, or these patterns of behavior or thoughts?
I think the key is knowing those warning signs. They will be helpful to let you know if you really need to speak to a health professional. For many people, just getting that accurate diagnosis is the first step in a treatment plan. Unlike diabetes or cancer, there really isn't any medical test that can accurately diagnose medical illness. A mental health professional will use the Diagnostic and Statistical Manual of Mental Disorders. You may have heard it by the DSM.
I have heard that before.
And this helps to make the diagnosis. It lists criteria, including feelings, behaviors, time limits that can need to be officially classified to diagnose a mental health condition. And then after diagnosis, the healthcare provider can help develop a treatment plan that could include medications, therapy, or other lifestyle changes.
It's something I've heard before. I think one of the biggest obstacles with someone going to reach out to a mental health provider or to get some help is just the fear of what they could discover, or maybe some of the stigma attached to it. Do you have any advice for someone who's afraid to take a next step?
Sure. You really shouldn't be afraid to reach out to someone. Learning all you can about mental health is the important first step. The National Alliance on Mental Health has a great website, and that's a great place to go and gain information. You can also reach out to your, primary health provider, state and county local mental health services, or you can also talk to your health insurance company to try to be directed to resources that are available. But, if you're really struggling or in crisis, I really urge people to call or text 988 or chat at 988lifeline.org. That's the suicide and crisis lifeline, available 24 hours a day, 365 days a year. Incredibly important to utilize that resource.
Absolutely. I was so excited to see when that change was made a year or two ago.
I agree. And, and there's trained professionals on the end of the line. You can chat, you can text, you can call. It's incredibly important to utilize that.
So what would you do, or what should you do, if you notice a friend or loved one struggling with their mental health?
Sure, just as I said before, you really need to learn all you can. Utilizing that National Alliance of Mental Health website, calling the 988 crisis line, or text them. It's really important to talk to them and urge them to talk to their healthcare provider.
Okay. Well, thank you so much for being here today, Dr. O'Neill. This is such an important topic, and I know there are, many Ohioans who struggle with mental health concerns, and just making sure that they are, staying on top of their overall health. So we appreciate your time. So in this part of the show, we're going to hear from another person at the medical board. We have our Chief of Quality Intervention here today, and we're going to be talking about impairment and really how the board has made changes to make sure that our licensees are receiving the treatment and care they need, and how we are even able to recognize these concerns that come to the board's attention. So first of all, what's your name, person from the medical board?
Brandy Dorsey.
Awesome. Brandy, what's your role here? We talked about you being the Chief of Quality Intervention, but what does that really mean?
I manage a number of different projects and programs. One of those programs is our confidential monitoring program, as well as the board's compliance program. The board's compliance program is responsible for the oversight of licensees who have board orders or consent agreements that outline terms and conditions for them to be able to either return to practice or continue practicing.
So, Brandy, when is an impairment problematic?
It's a really good question, Jerica. Impairment is problematic when a licensee has an inability to manage overall patient care, there's poor outcomes, there's inappropriate interactions with patients or colleagues, there's inadequate personal care, or there's legal issues.
Inadequate personal care. Does that mean hygiene kind of concerns maybe someone might see, or what does that mean?
Sure. Inadequate personal care can mean a number of things. Domestic violence. Inadequate personal care can lead to a number of personal and professional issues that could be reported to the board, such as, poor hygiene, unsanitary office conditions.
Very interesting. Well, Brandy, you mentioned earlier something about the confidential monitoring program. Can you explain what that is?
So the confidential monitoring program is a program that is managed by the board's contracted provider, which is the Ohio Professionals Health Program. The confidential monitoring program is a path for medical board licensees to confidentially receive treatment and support in a non-disciplinary program. This program allows licensees to voluntarily step away from practice while getting the care they need. And then when they're cleared to return to work, they can then resume practice with guardrails.
So as I understand it, the confidential monitoring program has recently been modernized. And so it kind of encompasses a wider variety of issues or concerns than it previously did. Can you talk a little bit about how the board expanded the program and also the importance of that approach when dealing with our licensees?
The board took a look at two programs specifically, the confidential monitoring program, which was managed by the board for licensees with physical health or mental health issues, and then the One Bite program, which was for licensees with substance abuse issues and monitored through the Ohio Professionals Health Program. The board looked at both of these programs and the laws and rules and determined what important updates needed to be made in order to allow greater access to the programs and appropriate monitoring with the programs. The board merged the two programs together and put them both under the Ohio Professionals Health Program. The board works closely with the Ohio Professionals Health Program to ensure that licensees have the help that they need, but are also practicing safely.
Ohio PHP is responsible to make the determination if someone qualifies for the confidential monitoring program. But if someone is not able to safely practice, or if someone does not meet the criteria or is not following the agreement or the rules of the program, what happens then?
The Ohio PHP is required by law to report any licensee who is disqualified from the program. So that way the board can then take the necessary steps to remove that licensee from practice until they are safe to practice again.
How is the board even made aware of issues of impairment, whether it's, again, mental health concerns or, physical impairment, which I imagine could be maybe some kind of health condition that would affect someone's body or ability to practice, or of course substance abuse, which we probably most often hear. How is the board made aware of these concerns, and what pathways do they come through?
We can get reports from patients who have identified potential concerns with a licensee during the course of their treatment. Maybe they noticed that they were impaired because of substance abuse, or maybe they had concerns that that licensee during their interaction had a cognitive issue or some other impairment that made them feel that this licensee wasn't able to treat them. Complaints from patients alleging potential concerns with, say, substance abuse or cognitive impairment or some sort of mental health issue. We can also get reports from collateral sources such as employers, other healthcare professionals, staff working with the physician. We also get reports from licensees. Does an impairment report result in automatic discipline? No. We have a confidential investigative process. We also have a confidential process for eligibility determination into the confidential monitoring program. At the end of the day, our goal is to ensure that licensees are practicing safely. So if there's any indication that a licensee is not practicing safely, then we do have to go down the road of formal discipline.
We'll be right back after a short break.
Family dinners, game nights, and holiday parties. It all happens at home. And we want to help you realize your dream of homeownership. We are the Ohio Housing Finance Agency, and if you're ready to buy a home, we may be able to help. Visit myohiohome.org for more information on down payment assistance, lower interest rates, and more. OFA makes purchasing a home more affordable. Visit myohiohome.org. Home ownership. Make it part of your future.
Welcome back. Today we're talking about impairment, and we're in the middle of a conversation with our Chief of Quality Intervention, Brandy Dorsey. I know we've had conversations in the past about how sometimes there are multiple factors involved with impairment cases. And so sometimes, as you mentioned, a complaint may come to the medical board that's not actually directly tied to impairment. It might be a criminal conviction or a report of a DUI or some other issue. What kind of behaviors do you see that are often linked to impairment of practice concerns?
Yeah, so there's a number of different practice issues that can come to the board that could be associated with some sort of impairment issue. We see it with minimal standard of care cases where there's errors made or there's poor outcomes, and that could be related to some sort of physical health or mental health or substance abuse issue. We also see it by the way of sexual misconduct complaints. We see complaints coming through criminal acts, arrests for various different things, whether it's, something obvious like a DUI or something maybe not so obvious like a domestic violence or even a stalking or a harassment. Those kind of arrest charges, sometimes those also have underlying mental health or substance abuse disorders as well.
I would say that all the things the medical board, does is important, right? Everything that we are focused on, everything that's outlined in the Ohio Revised Code that's under our jurisdiction, they're all things that are important. But I imagine there are some unique challenges and some unique risks when it comes to impairment. What are the risks specifically of not properly addressing impairment in a timely manner?
As I mentioned before, there is a number of different behaviors that are linked to potentially mental health or substance abuse, like poor outcomes, errors in treatment. The board's still going to look at those things. We're still going to say, did they meet a minimal standard of care? We may be addressing their physical health, mental health, or substance abuse separately by getting them in a program and getting them help right away, but we're still going to be looking into sexual misconduct. We're still going to be looking into minimal standards issues. We're still going to be looking at any violations related to arrest or convictions. So we're going to be tackling those issues kind of twofold. It's important that we know about these because the sooner we know about it, the sooner we can protect the public by getting the licensee the help they need, by working quickly to get them out of practice, either via a confidential monitoring program where they agree to stop practice or via board action. Licensee well-being is very important. So even if we have just an allegation of physical health, mental health, or substance abuse, and we have no other, concerns, no other indication of violation of the Medical Practices Act, it's really important to make sure that these licensees are getting the early intervention and help they need. It will help them in their career long term. Ohio PHP has done a lot of work with licensees and well-being, and the sooner we can get somebody the help they need, the better they are long term and the safer the public is long term. In certain circumstances, when a licensee is deemed ineligible for the confidential monitoring program and the board then takes formal action via a board order or consent agreement that provides a pathway back to licensure after a suspension period, those licensees then enter the board's disciplinary monitoring, where the board's compliance team works with the Ohio Professionals Health Program to monitor those licensees under the terms and conditions in those orders and agreements.
What does probation functionally look like? Is it someone, popping in like a probation officer? Someone might be familiar with that process in the criminal justice system. Is it kind of like that?
The board's probation monitoring it's a little different than, the criminal world probation monitoring. Licensees who are under the terms of a board order or consent agreement for, say, substance abuse, those licensees, they have to prove that they're capable of returning to practice. And then once they're capable of returning to practice, they're monitored for a term of 5 years. It's a long-term monitoring of drug screens and ongoing treatment and assurance that they're practicing safely. For licensees with physical health or mental health, those terms can be 2 to 5 years. Again, those are based on kind of individual circumstances and needs for that licensee.
What are some of the success stories of providers that complete the probation process?
Yeah, over my time here, over the last 4 years, I've heard a number of licensees who were very thankful for their ability to return to practice and the board allowing them to return to practice through monitoring. I think a number of them will say that they didn't love it at the beginning. That's what we've heard is, it seemed like a lot at the front, and was it worth it? And then we hear at the end that it is worth it and that they're thankful for the ability to get themselves in a better position, both professionally and personally. I think our biggest success stories, are the ones that unfortunately we don't hear about. I think those are the licensees who enter the confidential program and then do really well in the confidential program and then move on and practice and have a long, great career without ever having any other issues. Those are the ones that we never hear about. It would be great to hear those stories, but that's the purpose of the confidential monitoring program.
So the goal, really, in any time the board is taking action, specifically if they're going to put someone on probation, if this person is not qualifying for the program or had to be reported to the medical board by Ohio PHP, the goal of the board, if this person is able to be rehabilitated, is to allow them to kind of graduate into, practice without having to be monitored. But do we ever see cases where there are reoffenders, people who come through the program, maybe, either the confidential monitoring program, which would have been confidential at the time, or they are on probation, complete a 5-year kind of term or agreement, and then the board sees them again?
I mean, sure. Substance abuse is a relapsing disease. Not all people relapse, but it's a reality. And when a relapse occurs, if the board needs to intervene, the board intervenes and ensures that licensee is taken out of practice until they can safely return to practice. There's been situations when the board has said, we're going to permanently revoke a license if a relapse is so bad and a licensee isn't getting the help they need. And maybe there's some other factors such as, sexual misconduct or patient safety issues. The board's going to permanently revoke a license, and they've shown that they will permanently revoke a license when those situations occur.
It seems like it. Like every time I do one of these and I have a conversation with someone, it feels like it keeps coming back down to this idea of being able to trust the licensee is going to do what they need to do. And if that trust is broken, then we can't have the confidence that they can practice safely, and we have to act as a board. Does that sound right to you?
Yes. The board licenses a number of different professionals, but one of those professionals is physicians. And these people quite literally have other people's lives in their hands. And if they can't practice safely, then the board needs to give the public the assurance that they're going to stop practice, whether it be voluntarily through a confidential program or publicly through a suspension or a revocation.
I think you have given us a lot to think about today. I hope, again, everyone listening knows how to file a complaint. You go to med.ohio.gov if you ever have any concerns about provider impairment of any nature. But also, I hope that you thank your providers, because they are under a tremendous amount of stress and they do a lot for us. Thank you so much for being here today, Brandy.
Thanks for having me.
This topic hits close to home for so many people in Ohio, whether providers or patients alike. Although the details in these cases can be complicated, the board's responsibility is clear. Find the route that best protects the public and treats licensees fairly. We have implemented so many changes in the last year or so to make sure we are appropriately addressing concerning behavior relating to physical or mental illness and substance abuse, and that we understand the complexities of these conditions and provide a pathway back to practice for practitioners that can make the transition safely. Unfortunately, that's not always possible. Tune in next week to hear about a case where addiction and bad decision-making pay a steep price. Until next time. Thank you for listening to this episode of MedBoard Pulse from the State Medical Board. Special thanks to investigator Jason Alameda and the Chief of Quality Intervention, Brandy Dorsey, for helping us understand how impairment complaints are investigated and handled. Subscribe today to hear our episodes right away. For more information about the Medical Board, visit med.ohio.gov. You can also email questions or comments to communications@med.ohio.gov. And remember, the more you listen, the more you'll learn, the more you'll share.